I'm Jason Bloom. I'm a facial plastic surgeon in Bryn Mawr, Pennsylvania. Today I'm going to be showing how to use the Dermapose syringe system as well as the PureGraft 50 system for fat purification and sizing. Just lubricating it, getting some of the, so it slides okay, great. Pulling back and getting that negative pressure. So we're going to drain off some of the extra fluid here. You can see the blood starting to separate out. Good. Perfect. Now we're going to wash the fat into tissue wash port. Okay. All right, so now we're going to wash the fat. So through the tissue wash port, I'm going to add a total of 60 cc's of the LR. Agitate it a little bit. We'll set this down for a little bit. All right, so we've let the fat sit for over 10 minutes here. You can see it starts to separate out some of the red blood cells from this orangish fat from the drain port. We're going to take off some of the red blood cells, the excess tumescent and the wash fluid. You can see the tissue becoming less red, more orange. There's a little red in here. I'm going to pull that off as well. Good. Now we're going to do one more wash step. So we take our LR. Same thing. We're going to use 60 cc's in through the tissue wash port. little bit of agitation here. Again, we're going to let it sit now for about 10 minutes. So we now have our tissue graft. After 2 washings, we're going to, again, remove the rest of the fluid here. From the drain port. Let it through gravity, and we'll bring it towards the end here. Drain a little bit more off. Getting all of the oils out of here. Okay. Great. Now we take about a cc or 2 off of the tissue wash port here, just until we start to see the graft. Now what we'll use is we have our Dermapose, and we're going to put the graft into the Dermapose. So now, first of all, we have purified fat here. See how it's orangish in color? But now we're going to size the fat appropriately to 800 microns. We do that, you can see it's almost like a pasta extruder, kind of bringing the graft into the Dermapose. It's going to be a little bit more in here. Really kind of angle it all down towards the tissue wash. Got a little bit more. Great. So now, once it's in the Dermapose, there is a stand that comes with it, but we don't have the stand today. You put the lock on here, and now we're going to size it. So the screen's going to hold the wings, and we're going to push down on the outer ring of this. So as you can see, it just goes smoothly until you meet resistance and it stops. Now all of the graft is into the center syringe. You grasp it and you turn it. Now we have 30 mLs of now purified and sized fat. At this point, this comes with the kit. This is the 2-way. What you can do is then dispense the graft into each of these syringes for use, however much you want. And now it's ready for injection. And you can see the look of this fat is a lot cleaner, purer, smoother than what we had with all the red blood cells. Additionally, it injects a lot better as well. So you can see how consistent the fat is. Comes out of the syringe really nicely. So these are different gauges. Still get the same consistency. All right, so now we have the graft, which has first of all been purified with the pure graft system and also been sized appropriately down to 800 microns with the Dermapose syringe system. Really the importance of purified and sized fat is that first of all, we're really getting fat that's removed, all the contaminants are removed, the red blood cells, the excess oils, while maintaining the structure of the fat that's going to give us some volume, and all of the stromal vascular fraction, which is important for the stem cells and some of the regenerative properties of the fat. Additionally, when we're injecting, as a facial plastic surgeon, when we're injecting around the eye area, in the periocular area, mid-face, this skin, after we've done an upper and a lower blepharoplasty, eyelid lift surgery on this patient, once we've done that, this skin and soft tissue is very thin in this patient. We don't want clumpy fat when we're injecting. We want something that's uniform, that's going to stay in the place that we're putting it, and is easy to inject. You don't want it clumping up as you're injecting it through the syringe. And I will say that this fat is all of that. It allows me for easy injection. It's not clumpy, great for placement in the periocular area, mid-face, and anywhere in the face. So in this case, we've done a transconjunctival lower lid blepharoplasty, took a little skin pinch, and some of the fat pads are removed around the eyes. We're then going to take an 18 gauge needle. X marks the spot where I'm going to use as my entry port. Then I'm going to take an injecting cannula for use in this area. Multiple passes. I'm kind of sitting on the bone here and filling this periocular area. I can feel myself along the orbital rim, giving some volume. As we do these injections. So I'll put about 2 or 3 cc's right along the rim in the infraorbital hollows. Kind of get that lateral area too, that lateral orbital hollow. And all this is injected deeply along the rim and into the suborbicularis oculi fat pad, or the SOOF. Next, we'll take a little bit bigger gauge cannula. We're going to inject a little bit into some of the deep fat pads of the cheek, the deep medial cheek fat pad, and in the mid-face for support. I'll get into the lateral cheek, out over the zygoma here. And give some lateral volume. All right, I'm going to inject the other side here. And so personally, I've used both the Pure Graft and the Dermapose systems in this case. However, you can use just the Dermapose, and that's what a lot of people tend to do. You're getting about 70 to 71% pure fat in that case. The additional step is definitely incurring a little bit additional costs. However, you do get about 25% more purification of the fat. However, the system is easy to use, the Dermapose, and you do get a good amount of purification just using that system. Again, I'm going to make one little poke with my 18 gauge needle. I'm going to grab my fat grafting cannula. And I'm right along the bone in the infraorbital hollow area. You can kind of see me scraping along the rim of the bone. Looks good.